is a history of the healthcare system experimenting needlessly on black bodies. So when you invite black people to a trial, if all you will see is it's another experiment, another opportunity to experiment on a black body. My name is Quavar, and I consider myself, I say to everyone, I am a prostate cancer survivor. I was diagnosed and treated in 2021. I am now clear of prostate cancer, and I hope it continues that way.
How would you see the world being different if 1 in 4 white men got prostate cancer instead of 1 in 8?
One, there would already be a national screening program. The research will be more advanced as to, because if you flip the script and it was white men being twice as likely to be diagnosed with prostate cancer, then there would definitely be research as to why that is.
And
it's been known for over 20, 30 years that black men are more predisposed to getting prostate cancer. And yet still, nobody knows.
And Brian, you're involved in a whole bunch of local groups, and there's a WhatsApp group that you're part of. Do you think that, I suppose, understanding that there is this discrepancy is something that's understood by the majority of black men? Is it things that are talked about within your local group?
Yeah, it is. It is spoken about. And the other thing is that is also spoken about is the fact that even with those people who are aware of the risk and present themselves to be tested, they're turned away. And they're turned away by GPs when, even though, as I said, they may be at high risk, they black male over the age of 45 with a history of prostate cancer in their family. And they go to the GP and ask, can I have a PSA test? And the question is, why? Do you have any symptoms? No, you don't have any symptoms. But we all know that prostate cancer you can have prostate cancer without having symptoms. It's just another incident of racism when they're not offered early treatment or early testing, especially when they have that awareness and they present themselves. And if they don't have the awareness to challenge the GP, if the GP says no, if they don't have that knowledge, then they'll just walk away. And they could be walking around with prostate cancer. When it comes to how to encouraging more black men to present themselves for tests, one of the things that I say to men who are hesitant about having a PSA test, because some people say what they don't know can't hurt them, I say to them, what you know empowers you. It could help you, it could help your children, because as a black man or a black person with prostate cancer, if you're diagnosed with prostate cancer, it means that your sons are at risk of having prostate cancer and your daughters are at risk of getting breast cancer. So having that knowledge, whether you want to treat it or not afterwards, but at least have the test so that it empowers your lineage.